Can a large hole in the septum be repaired? The simple answer is yes. However, perforations over 2 centimeters in size are more difficult to repair. Why? Well, perforations that are less than 2 centimeters have plenty of surrounding tissue on the septum, the floor of the nose, and the outer walls that you can recruit to repair the perforation and sew things back together in a pretty straightforward, though technical manner. When the perforations exceed 2 centimeters in size, you really are having encroachment onto the healthy tissue that you would usually use to repair the perforation, meaning the amount of healthy tissue is very scarce and the size of the hole is very large. In those cases, you may have to recruit tissue from outside of the nose to help repair the septum. Although in many cases it's not necessary, but that surgery is definitely more complicated. It's in your best interest to have your perforation evaluated as soon as you can. If you know that you've been told that a perforation is, let's say, 1 centimeter, you shouldn't put your mind at ease. That's when you want to get an evaluation, because that means that you have a high chance of having a successful operation to repair that perforation. If you wait for a perforation to go from 1 to, say, 5 centimeters, the chances of you having a successful operation get very, very low. And so my advice is, as soon as you know that you have perforation, suspect that you have a perforation, or been told by another physician, that you see a specialist right away.